in 2020 with the COVID pandemic, and I would recommend that, from the moment we're all old enough to kind of understand about preventative health, that we should start to think about our health. It's one of those things that we all take for granted, but certainly is so important. When we talk about testing and screening for breast cancer, that should start around age 40 in terms of having mammograms if there's no other family history. But I think for women of any age, important things to know about are, what is my family history? Who in my family has had cancers? When did they have those? To think about important things like weight. Obesity is a risk factor for breast cancer. There's good data that people that exercise while they have breast cancer do better. We all know that smoking is a risk factor for multiple types of cancers. And so increased alcohol is a risk for multiple types of cancers, including breast cancer. So I would encourage women, from the moment that they're old enough to kind of take care of themselves, to think about their health and to take responsibility for that, because many times we don't do that and then we wish we had later on. But around age 40 is when a woman should have a primary care doctor and should be making decisions about starting mammography. In America, there's a chance of, 1 in 8 women is going to have a diagnosis of breast cancer. And so I think for all women, they should know that breast cancer is a risk to their health and is something that they should be aware of. For women that have a family history of breast cancer, their chance can go up even higher. And so knowing what that family history is and knowing how they should then have screening and what should be done based on their family history is very important. And then for women that, have breast cancer, they should know that, the majority of breast cancer is very treatable, and, they should have doctors and a team that they trust in place. So it really depends on who you are and in what way breast cancer is affecting your life. And certainly as women, we're caregivers. And so whether you're, 20 years old and you have a family history, or whether you're a patient that has breast cancer, or you're, a friend that's supporting someone that has breast cancer, there's so many important things to keep in mind just for the role that you're playing at that time, and for all of us to support each other as women. So mammography is a way of looking at the breast and is a screening test to try to detect early breast cancer. Early breast cancer can generally be removed with surgery and sometimes does not require any further treatment depending on when it's found. So mammography is a screening tool that for the average woman, she should start having mammography around age 40. Things that change that include family history, and history of other cancers or chemotherapy, but ideally at age 40. But I would encourage women, as they're seeing, an OBGYN or they're seeing a primary care doctor, even in their 20s and 30s, to go ahead and know about their family history and to have that discussion in advance in case they needed to start screening sooner. No one specific diet that anyone should follow, but the two things that I think we know the most about that definitely increase the chance of increase the rate of contributing to breast cancer are smoking and alcohol use. And so smoking is a risk factor for multiple types of cancer, certainly for lung cancer, for blood cancers. And so I would encourage women to not smoke or to use nicotine products at all. In terms of alcohol, the risk of breast cancer goes up significantly when alcohol use increases above more than, 5 to 7 drinks per week. So if you're having more than a drink a day, if you are, binge drinking over the weekend and having days where you're having multiple drinks, on Friday and Saturday, that's the time to really kind of cut back. So it's one of those things that drinking a little bit of alcohol doesn't increase the risk significantly, but drinking a good bit of alcohol can certainly significantly increase the chance of breast cancer. And then the other thing that's not one specific food or substance to avoid, but obesity increases the chance of breast cancer. So staying active, trying to eat, a diet that's full of lean meats, multicolored vegetables, and is low in like saturated fats and sugars is important for kind of overall health. And it's also important, to stay active and to exercise. I think being aware of your body, being an advocate for yourself, having a doctor that you trust, trying to maintain a normal weight, exercising, avoiding tobacco products, minimizing the use of alcohol, all of those things are important to stay healthy. And certainly, at NorthCrest, and just as a doctor that's employed by Vanderbilt, we want to make sure that, women have a doctor that they feel like they can talk to and that they can trust, and that they know that somebody's listening to their concerns. And so I think it takes a team effort to keep everyone as healthy as possible.